Hello, I'm Dr. Sandeep Patil, Chief Intensivist and Physician at Fortis Hospital Kalyan. Sir is Dr. Pradeep Vyavahare, Senior Urologist working at Fortis Kalyan. We are presenting our challenging case. One young female got admitted at our hospital on 22nd of Jan. She was shifted from peripheral hospital with history of 2 days history of left flank pain, vomiting. There she was admitted. She had received painkillers. After that she collapsed. She was shifted here at Fortis Kalyan in shock state. When she arrived in emergency room, patient was conscious oriented, was in shock. Blood pressure was on low side, had restlessness. So considering the history, we decided to go ahead with CT abdomen urgently. As we were suspecting severe urinary tract infection. Her sugars on admission were very high, more than 500. First time detected diabetic. As soon as we got the CT abdomen report, CT abdomen showed left emphysematous pyelonephritis. So immediately I had informed our senior urologist, Dr. Pradeep Vyavahare, who was luckily within the hospital to look at the patient.
I saw her immediately and I decided that within no time we should put a stent and give her a trial of saving the kidney. So within 2 hours we put a stent. Within 2 hours of admission we put a stent, and then patient was put on supportive therapy. She was on ionodrops. And still she, in spite of putting stent, she deteriorated at night. And she had no urine output at night. So she was put on dialysis.
As soon as we got the CT done, patient was resuscitated. Decision for degestenting was taken. Patient was stable issue that she could undergo surgery. Her creatinine was high to 0.3. Platelets were on lower side 50,000. The risk was explained to the patient and relatives that we'll have to go ahead with this surgery to reduce the source of infection. Post degestenting, the patient didn't have urine output. Patient was critical, so nephrologist was consulted. Decision for immediate dialysis was taken. Patient was on high dose of vasopressin to maintain the BP. So slow dialysis sled was done overnight. Next day morning, patient was still critical. Patient was maintaining hemodynamically stable. Creatinine had come down post dialysis. Platelets were still on the lower side, but patient developed atrial fibrillation. Patient was going into multi-organ failure. So decision was taken to do a repeat CT.
But I saw repeat CT and it showed increased amount of gas in the parenchyma as well as the venous system. So kidney was almost completely destroyed. This is a rare case of emphysematous pyelonephritis where you get a gas in the venous system and kidney is completely destroyed. To date, 16 cases have been reported in the literature, and this is the 17th case in the world where there is a gas in the venous system. Young diabetic female with severe emphysematous pyelonephritis, multi-organ failure and septicemia. So we took a decision of going ahead and taking out a kidney because that is a life-saving procedure for the patient. So relatives were consulted thoroughly about the pros and cons. To take such patients for nephrectomy is also a big risk because she was in septicemia, multi-organ failure, and she was on vasopressors. At night she was dialyzed. So taking and giving anesthesia is also a risk in such patients. But we consult the relatives that we had taken a risk of surgery.
So the patient, as the patient was still critical, and the second CT showed increasing gas, and gas was in the renal vein. So we jointly decided to go ahead with nephrectomy. Everything was explained to the relatives. Since it was a life-saving decision, the relatives agreed for it. And then we proceeded with nephrectomy.
So let's to know, and there was definitely as for bleeding, anesthesia risk was there.
Anesthesia risk. How did you go ahead with the surgery since the platelets were low? It's comparing.
We had given a transfusion, single donor platelets, and FFP all were supportive given and then taken on table within 24 hours. We took her for surgery within 24 hours because we wanted to knock out the source of septicemia and multi-organ failure. And that was the best chance for her to survive. Fortunately, relatives were consulted properly and they took a decision for going ahead with the surgery, and they knew the pros and cons. And since the OT and our staff and everybody is well equipped, there is a multidisciplinary approach. Everybody is involved, so we took her for surgery. We went ahead with left flank approach in a lateral position under general anesthesia, and we did quick nephrectomy. Within 2.5 hours, we could finish our job, and then patient was shifted to ICU back on ventilator. Throughout the night, she was on ventilator.
So post-op patient did well. Overnight patient was on ventilator. Next day morning we could wean her off and take her off ventilator. Patient was hemodynamically stable, so we could taper off the BP medication, vasopressors. Creatinine was on higher side. It was on around 2.3. We started on around diuretic infusion, Lasix infusion, so that urine output improved. Fortunately, she responded to medical management. She didn't require dialysis after that. Blood culture and urine culture we had sent on admission had grown Klebsiella pneumonia. Antibiotics were continued as per that. She continued to have low platelet count for next 3 to 4 days, but she was clinically improving and there was no bleeding from operative site. Patient improved over next 4-5 days. Creatinine also started coming down, urine output improved. So by 7th day, patient was absolutely fine. Platelets were normal, counts were normal. Creatinine had come down to 1.2. Patient was absolutely hemodynamically stable.
We removed the drain and we inspected. Wound was fine. Patient was on full diet. She was completely mobilized. Sugars were under control, and she was likely to be discharged. Her final histopathology report we have seen, it showed there is a totally non-viable parenchyma. Totally non-viable parenchyma. His kidney was not viable. So the quick decision of taking it out was life-saving.
Hi, my name is Vrishari Mathuri. 22nd of Jan admit झाली. त्याच्या अगोदर it was like की Fortis यायच्या अगोदर I was just Sundayला Saturday पासून I was just feeling a severe pain in my stomach area and my back area. It was paining very much, unbearable it was. And then I went to a hospital nearby, and then from there I started experiencing breathlessness, like severe breathlessness it was. म्हणजे अजिबात मला श्वास घेता येत नव्हता, मला समजत नव्हतं what's happening with me. Then that hospital decided, they asked me in which hospital you want to go, transfer case, because they were not able to provide that much of facility. So my family decided quickly to go to Fortis Hospital. So in the 22nd in the morning, we came here in the Fortis Hospital, and immediately the staff, they immediately started treating me, started doing all the tests on me, everything. I was nightmare because I was feeling pain, I was breathless, everything was at the same time. But then I was immediately shifted to ICU, and they started treating me, started doing all kind of tests on me. Then the doctor came, they examined me, everything, and they came to know that I have a issue with my kidney. And because of that, or what, I don't know, but my sugar, they were spiked up, and everything was actually going out of control. Initially on 22nd, they did one operation on me, minor operation on my kidney. And the very next day, doctor told my entire family that we need to do a major surgery on my kidney because it is not working. One kidney is not working. So the promptness of all the doctors, attentiveness and everything was so quick, and it was like a miracle, a miracle happened with me. All thanks to the doctors. All the doctors I would like to thank.
हां, मी रुचानी चिवाहा. मी फक्त कल्याण फोर्टिस, माझे नातेवाईक यांचे मी आभार मानतो. आणि डॉक्टर प्रदीप व्यवहारे, संदीप पाटील यांनी खूप मेहनत घेतल्याबद्दल त्यांचे पण मी आभार मानतो. तिला दुसरा जन्मच त्यांनी दिला आहे. आणि कल्याण फोर्टिसचे तर खूपच आभार आहे. त्यांच्या खूप सोयी आहेत त्यांच्या.
मी संजय पैंगणकर, मी वृषालीचा मामा. मी घाटकोपरला राहतो बिकॉज शी हॅड गॉन फॉर सम ऑफिस वर्क ॲक्च्युली अँड शी वॉज आउट ऑफ टाउन and then suddenly this call was little surprising for all of us to what happened. And then he told me that she has some pain in the back and stomach and all. So we first thought it must be some kind of a kidney stone or something like that. So bringing her to Fortis was the ideal thing that he could have done at that moment, because Fortis being a tertiary care hospital that really helped at that point of time.
Hi, I'm Sagarika Paigankar. I'm Vrishali Mathuri's sister. Vrishali is my best sister. So the last memory when she was not in Fortis Kalyan, which I have, is she was on an official trip for a conference in Jinkovic. And I had spoken to her through messages, I remember. And she was in fact enjoying her trip there. She went on to a safari. So that was on 20th January. And 22nd January in the morning, I call her up because she was not picking up my calls. So, and my uncle picks up the call. Even like Aga just picks up the call and he's saying that she's not well and I'm rushing her to the hospital. And suddenly, so many complications together. So for us to understand and to, accumulate everything and to reach to a decision was very difficult. So, but yeah, thanks to the doctors, the condition in which I had seen her in those 3-4 days in ICU, and like I really don't want to even remember those days, frankly speaking. But yeah, today she is all good. She is walking. I'm very happy that in next few days I'll be walking back her home. And thanks to the doctors and the hospital that for giving me my sister the way back the way she was. We were sorry to mommy. Actually, इसके filled out. It was just like Satrika said in for Sunny's school. Like what it is, how it's just like a family, right? Everything, anything, whatever is there, we are all together. And the chain of hospital and network, he said this is one of the best. Like it is all equipped with all the facilities. I said we should not compromise yet. So we should be one of the best. Then we rushed down here, and then it was so bad, like she was literally gasping. And it happened so fast that we were very shocked to that way. But then we took decisions. The doctors also told us everything very systematically, and their approach and the way of explaining us things, they were not reluctant at all, and they kept telling us how it goes and how this will work and how she can come out and what has to be taken and what decision has to be taken right now and just what is priority. That also he explained us. So that which helped us to take the decision in just less than 10 minutes ki yes, we have to go for this. That will be a lifesaver. Miracle, and we did that, and really it happened. Thanks to Fortis Kalyan and all the doctors, they were great, and we brought Vrishali back into action.